just as we all thought the coronavirus epidemic was coming to an end, cases in countries outside of China exploded, with, for example, South Korea reporting hundreds of cases in a matter of days, and Italy going from 3 to 229 cases in a course of 48 hours. So now, can we justify this as a pandemic? Anyways, as of 9:40 p.m. Eastern Time on February 29th, 2020, which is when I'm recording this, there are 86,960 cases, which again, a vast majority are in China, 79,800 to be exact. Well, to be close to exact. There are 2,977 deaths and 42,216 recoveries, which, just to mention, is more than double it was a week ago. Even though cases worldwide, even though only cases worldwide, they haven't increased by a matter of even 10,000. So many of these outbreaks outside of China are what has dominated the news recently. For example, South Korea has 3,526 cases now and 17 deaths. They were the first country outside of mainland China to report 1,000 cases. Italy, 1,128 cases. They were the second, and they have 29 deaths. They went from 3 to 229 cases in the course of 48 hours in the Lombardy province of Italy, which contains Milan, one of the largest cities in Italy. This was not great, let's just say it that way. It has spread all over Europe since then. Now, France has 100 cases and 2 deaths. Germany, 79 cases. The United Kingdom has, I think, 33 cases. Spain has 50 cases. The United Kingdom has 23 cases. And a majority of the countries in Europe now have at least one case. So that's obviously not a good thing. Another one of these outbreaks has occurred in Japan, with a majority of their cases being from the Diamond Princess cruise ship, to be exact, 705. But overall, they have 946 cases and 11 deaths, 241 of which were actually occurring in the country rather than from the cruise ship, and 6 of the deaths were from Japan, specifically, not the cruise ship. Now, this outbreak really entices me. This is Iran's outbreak. 593 cases, but an astonishing 43 deaths. Now, this is around an 8% death rate, which is 4 to 5 times higher than what we have seen outside of the Hubei province. That indicates one of two things: an extremely underdeveloped health system, or just simple unluckiness, because as of now, there are only 593 cases. If there were like 100,000 cases in Iran, you probably see less deaths. Or, what's more likely, they are covering up an outbreak. Or they're missing cases. Now, 43 deaths is really astonishing. Like, for example, Italy, they've had one of the more noticeable death rates, which is still in itself like 2.3%. South Korea has a 0.5% death rate. That's not that insane. So it begs the question, how many cases do they really have? With 43 deaths, I'd expect more like 2,000 cases, which put them at second outside of mainland China. So they have to be missing something. It seems very obvious by the amount of cases and the amount of deaths that they have, that there has been some sort of cover-up. Now, Singapore would be the other 100-plus outbreak with 102 cases, but a majority of them have been recovered cases. They haven't even reported a death yet. They do have some critical cases, though, so we'll have to keep in tune for that. Now, the situation in Europe, specifically because of Italy and open borders in the European Union, has caused, pretty much every single country in Europe to have a case. Now, I've already explained these the amount of cases in countries bordering Italy, like Germany and France, and they have a lot of cases. They've seen spikes themselves. Now, both of these countries already had around 20 to 30 cases, but now both of them have 79 or more. So that's obviously not a good thing. Now, I haven't covered the United States because I thought I'd save it for the end. There's 70 cases in the United States, which is a boom from last week. The last time I reported on this, there were 35 cases in the United States. But many of the new cases have been specifically cases that have occurred from the Diamond Princess cruise ship for like the people repatriated to the United States. And 7 of them were new, like on U.S. soil. All 7 of them were believed to be transmitted. There are 22 U.S. soil cases. Now, there's 7 transmissions in the last week. Now, this could the problem with this was that there were no reports of these people traveling somewhere specifically or being in contact with someone who they know has been infected. That's the problem. That's an example of community spread, because community spread is when you have an infection of a disease that is unexplained, so that you can't really connect it to anything. So that occurs with the flu virus all the time. I mean, you're not going to really know because there's so many cases of it. But yeah. So this has occurred in both Washington and in Northern California. Now, Washington State reported their first death. It was a man in his upper 50s with an underlying health condition. I mean, what do you expect? It's very likely that people with underlying health conditions or underlying health issues or that are older will succumb to this. It's much more likely. But there are always discrepancies. So this begs the question, are we missing anything? That could be, I think so. I personally believe that we've been missing an outbreak. Here's why. So we are still at the height of the flu and common cold outbreaks. Outbreaks, but so this is the flu season. This is the cold season. So because the symptoms for these viruses are so alike, it's very difficult to distinguish the two. So people that have strong immune systems that were affected by this or infected by this probably wouldn't really think of it as the coronavirus. They might be like, oh yeah, there's a 0.7% chance that I have it, and then they think they have the flu because they recover from it and they don't get asked to take a test. So that's a problem. So because the flu season and the flu season and the cold season are so intertwined in our brains, we wouldn't really notice the difference between the flu virus or the coronavirus, for example. So this means we could be missing a lot of cases. And the CDC has been saying, oh, the threat to the general public remains very low. Well, see, this might be actually a problem, because now these people are discrediting it to be foreign, to be entirely foreign, when maybe they're actually being infected by it as they speak. So, of course, that's problematic. And then just simple underreporting. We have an instance of an outbreak in a nursing home in Washington. It's called Life Care Center in Kirkland, Washington. They have said that dozens of people are exhibiting very similar symptoms to what the coronavirus gives symptoms for. And that is especially problematic because, this is a nursing home. These are older people. These are elderly people. And, of course, as we know from previous cases, the death rates for older people are far higher than for someone who's 26 and works out all the time. So that is very problematic. If 35 people were to be infected by this and they were all 80 or older, I'd expect 5 to 7 of them to succumb to it, which that is especially scary because you always want to keep. They always try to keep those viruses out of a nursing home. Like, for example, when I was in 5th grade, we were going to go to a nursing home to sing, like, Christmas carols. And we actually were not able to go in because it was during the flu season. And because elderly are likely to succumb to it, or more likely to succumb to it, they don't want us in there. So, like, these outbreaks could be very, very, very terrible, especially for the elderly population. I mean, it's occurring at a nursing home. So, well, my wishes are out to those people, and I hope all of your wishes are too. So, I mean, it's really just honestly a matter of time before we start seeing, like, sustainable community spread, which would justify it to be a pandemic or an epidemic here specifically. So, I mean, yeah, we just got to see what happens this week. I mean, we had our first death today in the United States, and there are likely to be more. Even with SARS, we didn't have a death, and that had a 5 times higher death rate. So anyways, thank you for watching, and I hope you guys enjoyed.